All right, thank you. Disclosures, none of which are pertinent to this talk. So the pendulum of spine surgery over the last 10 years has really switched from all posterior techniques, all more to anterior type of techniques. And whether those techniques are moving all the way back to ALIFs or these are more or newer techniques such as OLIF, anti-psoas techniques, or XLIF, LLIF, whatever you want to call it. But what's the real rationale between any LIF or any interbody? It's really to improve fusion rate, to facilitate deformity correction, to provide foraminal decompression. That's what we want to get done. And why lateral surgery? I think there's a lot of benefits to lateral surgery, whether it's anti-psoas or trans-psoas. But why single position surgery in general? And I think there's just a little bit too much to get into right now, but there are particular patient and surgeon hospital benefits to single position surgery. I think the real secret sauce that has allowed us to do single position deformity surgery is the ability to perform a decompression with the patient in the lateral position. You have to be able to decompress the nerves while in that same position. So we looked at 32 consecutive adult spinal deformity patients that had sagittal imbalance. They underwent single position deformity surgery with that lateral screw rod construct, which I'll show you in a second. And some of them had anterior column realignment procedures. We looked at radiographic outcomes, and we looked at patient-reported outcomes. In terms of patient treatment variables, operative time was about 200 minutes and blood loss was less than 200 cc's. This is a case example. This is what we're talking about. This is a coronal deformity with also a sagittal imbalance that we treated with this lateral screw rod fixation with interbodies at every level, and you can see that had pretty good coronal and sagittal correction. In terms of radiographic outcomes, we had improvements in all sagittal parameters as well as coronal Cobb parameters, and those were statistically significant. In terms of the patient-reported outcomes, preoperative VAS scores for back pain were 8.4, and at 2 years it was down to 3.5. That was a change of 5, and it was significant. ODI scores were 61 at the preoperatively, down to 28 postoperatively, and that was also significant. In terms of complications, we didn't see any proximal junctional kyphosis, and there was no permanent motor deficit in our small series of patients, right, 32 patients. So I think single position surgery with the lateral screw rod construct for adult spinal deformity was safe and effective in this small cohort. It allows for powerful coronal and sagittal deformity correction and improvements in patient-reported outcomes. Thanks.